Hi, I'm Linda. In this video, I shall explore what is multiple sclerosis, its cause, symptoms, and diagnosis, also the 3 phases of multiple sclerosis and much more. I shall start with what is multiple sclerosis. Multiple sclerosis is a type of arthritis that attacks the nervous system in the brain and has many complex challenges. Its chronic autoimmune disease affects the central nervous system. It is an autoimmune disease that attacks the covering of the nerve fibers, known as myelin. These are sheaths in the immune cells that may cause inflammation of the demyelination, and protect the covering of the myelin sheath. It also disrupts the normal flow of electrical impulses along the nerves. The center of the nervous system is in your brain, which leads to the eyes, optic nerve, and the spinal cord. There are lots of risk factors with multiple sclerosis, but the 5 common ones include: Number 1 is genetics. If anyone in the family has multiple sclerosis, you may be at a high risk of developing the disease. Number 2 is that environmental factors such as viral infections or exposure to certain toxins could contribute to the development of this disease. 3 is autoimmune response. This one is if you have a low level of vitamin D, it has been found to increase the risk of multiple sclerosis. Number 4 is smoking. If you smoke, you should stop, as this is a potential environmental factor that can increase the risk of developing multiple sclerosis. And 5 are geographical and ethnic factors. Multiple sclerosis has been found in various geographical areas with higher rates, such as in Northern Europe. The symptoms of multiple sclerosis could include fatigue. You may become fatigued and sleepy all the time, even though you have had a good night's sleep. This can greatly impact your daily life. Weakness in the muscles may become weak. You may also have tremors, difficulty walking, and coordination problems. Sensory disorders. These could be sensory issues, like numbness, tingling, or pain, often affecting the limbs. Cognitive impairment, which is memory loss, attention problems, and difficulties with problem solving. When you see your doctor, they may ask for your medical history, which includes the progression of the symptoms. They will also give you a clinical examination, and you may be taken to a neurologist, who may perform a thorough clinical examination to assess your neurological function. They may send you for an MRI, magnetic resonance imaging, which looks for any lesions or plaques in the brain and spinal cord which indicate demyelination. Also, they may perform a cerebrospinal fluid analysis, which is a lumbar puncture that can analyze cerebrospinal fluid. Treating your multiple sclerosis could be the following. Your doctor may give you some medication, such as disease-modifying therapy, which can reduce the inflammation and slow down the progression of the disease. Symptomatic treatment is physical therapy, that decreases some symptoms such as muscle spasms, fatigue, and pain. Physical and occupational therapy can improve mobility, strength, and overall function. Monoclonal antibodies are a type of biological therapy that has been found a positive treatment for multiple sclerosis. Another one is stem cell therapy, which uses stem cells to repair damaged nerve tissue and control the immune system. Complete rehabilitation programs, mental rehabilitation with physical occupational therapy, can help increase your functional abilities, improve mobility, and enhance your overall quality of life. When you develop multiple sclerosis, you may go through 3 phases. They are relapsing remitting, remission secondary, or primary progressive. Phase 1 is relapsing remitting. This is the most common form of multiple sclerosis. If you develop this first phase, you may experience periods of new or worsening symptoms or relapses, followed by periods of partial or complete recovery. The second phase is remission secondary. In this phase, the progressive multiple sclerosis symptoms gradually worsen the neurologic function with or without relapses and remissions. And the third is primary progressive multiple sclerosis. This form of multiple sclerosis is a gradual and steady progression of symptoms, without distinct relapses or remissions, and is less common than phases 1 and 2. The nature of recovery may differ based on the specific phase that you are in, and the response to treatment. Also, you could experience natural remission, which means that the symptoms improve or disappear for a long time without medication. However, the remission can vary from person to person. The complication of multiple sclerosis is an active neurological condition. Therefore, it is vital that you keep your appointments with your doctor and healthcare professionals. It would also be good if you understand the workings of multiple sclerosis, as it is crucial for early diagnosis from disease-changing therapies that attack the immune system. Cutting-edge research in stem cell therapy looks promising for those of you with multiple sclerosis, as research advances and new treatments emerge. The hope is that people with multiple sclerosis will continue to experience improved outcomes and a better quality of life. If you have developed multiple sclerosis, you should work closely with healthcare professionals to develop personalized, unique treatment plans. I am not a medical professional, and this video is for information only. If you are worried about anything, you should consult your doctor or healthcare professional. Thanks for watching this video. If you found it helpful, then please click the subscribe button to follow my channel, and click the bell. If you have any questions, please leave a comment below. I hope this has helped you, and good luck.